The big, beautiful bill just fixed healthcare. So if you all have been paying attention, you know that the big, beautiful bill just became law, and stuck in there was a section about direct primary care, the so-called concierge medicine or membership model primary care. Specifically, it specifies that these are primary care providers who charge a membership. It has to be under $150 a month. At Big Tree Medical, we're about $80 a month. And those plans are now compatible with health savings accounts. So this is really important on several levels for different groups of people. So if you have a direct primary care membership, it's now officially cool for you to pay for that with your health savings account dollars. That was unclear in the past, so we really just haven't talked about it much, but it is definitely okay as of January 1st. Secondly, if you have a health savings account, you can still contribute to it if you have a direct primary care membership. Again, this was unclear in the past. This bill clarified it. That's really important for employers who have health savings accounts. We think the best way to have a employer-sponsored plan is to have a self-funded plan that has only an HSA option, and then you include a direct primary care membership. This allows your employees to get concierge level service, 24/7 access to care, really high touch personal care that uses technology and gets them in quickly and deals with their issues at zero cost to them. And then an HSA sort of account so that they have that option to pay for things they need, but they still feel the pinch of more expensive services with a backup of an overarching high deductible health plan for if they get really sick. So at our company, we're switching all of our employees over to such a plan. The last group we think this is really important for is for people who want a great health plan but are tired of paying PPO prices. So this may be that your employer offers a PPO or an HSA option. PPO is a plan that has like deductibles and typically a copay. So a $25 copay for a specialist or a $10 copay for primary care or something like that. That's a PPO plan. You're going to get way better service at a cheaper price with a direct primary care relationship. So in that case, you'd switch your PPO plan to an HSA plan, which would save your employer money. And then they'll typically contribute to your health savings account. You take some of that money and pay for a direct primary care membership, and now you have the best healthcare you can imagine, plus the backup of health insurance. This, I think, is a really great option for people whose spouse is on a plan. So if my spouse were on a plan or my kids were on a plan, I would switch them from the PPO plan to the HSA plan to save dollars, and then enroll them in a company like Big Tree where they can get really high level service. It's really unlike anything you're going to get at a traditional healthcare setting. You know, we offer same day appointments. We're addressing all sorts of primary care needs, but also all sorts of other things people are interested in, like advanced biomarker testing for longevity purposes. We do Botox, and we do peptides, and we do weight loss. I mean, really a completely different level of service than what you're used to in a traditional doctor's office. We have a big webinar on this that's going to go into all the details here in a few months. You can sign up for that, or feel free to check out our website to learn more information.